Ubilijit Yara. President Bola Tinubu has approved the appointment of 3 new executive commissioners to serve in the Nigerian Upstream Petroleum Regulatory Commission and the deployment of 1 current executive commissioner pending their confirmation by the Nigerian Senate. A statement by the Special Advisor to the President, Media and Publicity, Ajurun Gilali, said Bashai Ndabawa, Northwest Executive Commissioner, Exploration and Acreage Management, Kelechi Ofuebu, Southeast Executive Commissioner, Corporate Services and Administration redeployed, and Orense Amadansu, South-South Executive Commissioner, Development and Production, and Babajide Fashina, Southwest Executive Commissioner, Economic Regulation and Strategic Planning. The President approves this reshuffling and replacement based on his deeply informed assessment of all factors concerning the sector with a view to establishing a regulatory framework and culture that comprehensively disincentivizes errant behavior and incentivizes diligence and resolves rules-based business practice across the industry. Senate has mandated its Committee on Establishment and Public Service Matters to investigate alleged lopsided recruitment into the Federal Civil Service. The resolution of the Red Chamber followed its consideration and adoption of a motion titled Urgent Need to Ensure Federal Character Principle, Curb Lopsidedness and Emerging Infractions in the Recruitment and Deployment of Officers by the Federal Civil Service Commission and related agencies, sponsored by Senator Titus Zam. In his lead debates, Senator Zam noted that the Federal Civil Service Commission was established with the responsibilities of recruitment and deployment of officers with requisite qualifications into the Federal Civil Service. The Senator said the major plank on which the Commission realizes its vision of building a highly focused, disciplined, committed and patriotic civil service is the advertisement of vacancies for the ultimate and equitable recruitment of applicants into the service. In education, Academic Staff Union of Universities and the Committee of Vice Chancellors of Nigerian Universities have described a plan by the federal government to automatically deduct 40% from the internally generated revenue of universities in the country as an attack on the university system. The federal government, in a letter dated October 17, 2023, entitled Implementation of 40% Automatic Deduction from Internally Generated Revenue of Partially Funded Federal Government Institutions, said it would begin the deduction with effect from November 2023. However, the National President, ASU, Professor Emmanuel Sodeki, insisted that federal government's decision was disheartening, saying universities were not generating any revenue from the user charges or service fees they gave students, arguing it was surprising that the government still wanted to collect from the subsidized charges on hostel accommodation, lab coats, etc. of students. The Secretary General Committee of Vice Chancellors of Nigerian Universities, Professor Yakubu Oshefu, revealed that the amount deducted by the federal government from the universities was 25%, but was increased to 40% recently. Professor Sodeki called on parents, students and Nigerians as a whole to rise against what he described as an attack against schools, adding that ASU would also meet with the federal government agencies in charge of the policy to take the next line of action. Ghana's publicly funded Okolebu Teaching Hospital in the capital, Accra, has reopened after a 5-month closure. The country's largest treatment center for patients suffering kidney disease shut due to budgetary issues and inability to pay for the everyday needs of those needing its services. The hospital management announced that it was in collaboration with the Ministry of Health to resolve debts resulting from cost under recoveries. Reports say the Ministry of Health is working closely with the management of KBTH to offset 4 million Ghana cedis debt occasioned by the cost under recoveries. The cost of treatment at KBTH was $190 per week, considerably lower than private hospitals' rates. Meanwhile, Ghanaian Members' Parliament had summoned Health Minister Kwaku Ageman Manu over the unit's closure, adding that many patients who could not afford treatment at private hospitals were left without options during the closure. And that's it on the News in Brief. Join us for more reports at 3 p.m. I am Ubilijit Yara. Good afternoon.